So New York City has the highest number of homeless people of any big city across the country, and those numbers have been steadily increasing since the start of the COVID crisis in March. In a recent interview on New York One, Police Commissioner Dermot Shea says the NYPD is doing the best it can in the wake of the recent budget cuts, which dissolved their homeless outreach division. Take a listen.
We got to bring the services, I think, to them and make sure that we're doing everything we can to give people the services that they need.
All right, so the Coalition for the Homeless called the city's response a pandemonium, and it now only seems to be getting worse. So we are joined this morning by Giselle Routhier, the policy director for the coalition. Giselle, thanks for being with us.
Me.
All right, let's get right to it, because at the start of the pandemic in March, there were nearly 61,000 homeless people in New York City. Where does that number stand today, 5 months later? Because I got to tell you personally, we've been essential employees heading into work throughout all of this. I see an uptick in the homelessness on the streets.
Yeah, so to be clear, that 61,000 number is specifically the number of folks that are in the shelter system, not the number of folks that are on the streets. And so where we're at today is around 59,000 in the shelters, and that includes the hotels that the city is using as de-densification sites. We've seen a slight decrease in the number of families, but a continued increase in the number of single adults. But again, that does not include the number of folks on the streets. And what we've seen also anecdotally on our programs is there are people that have become newly homeless as a result of the pandemic because they were living in unstable circumstances, and they are rightfully scared to enter the shelter system given everything that we know about how the virus spreads in crowded settings.
All right, let's tackle this one at a time. Current conditions don't account for people, as you mentioned, could be facing eviction in the coming months. So how is the coalition prepared to handle that influx of people that have really nowhere else to go?
Well, to be totally clear, one small nonprofit cannot handle the crisis that we're about to experience over the next few months. The biggest thing that we need is $100 billion from the federal government to help provide rent assistance for people facing eviction. People have lost income from jobs. People are behind on their rent. Eviction moratoriums are running out, and we're facing a really critical time where we could see across the country 20 to 30 million people evicted. In New York City, that could be tens of thousands and more. So what we really need here is government intervention to provide income supports and rent supports, and we need the city and state to help supplement those efforts as well.
It is multi-layered, though, because NYPD says its hands are tied because of the budget cuts, right? You're asking for more money from the federal government. Everyone's asking for money, but everyone's trying to find that money. Because of these budget cuts, they've had to, the NYPD, dismantle the homeless outreach division, right? So what can they do to help alleviate this situation? Because we have both agreed here that we're seeing more and more homeless people on the street.
Yeah, so I want to be really perfectly clear here. Experiencing homelessness is not a crime. And so we've never supported the NYPD being the front line in terms of helping folks who are experiencing homelessness on the streets. That should be trained service providers linking people up with resources that exist. So there are two problems here: increasing the number of resources that exist to get people into housing, and in the short term, specifically to get them into safe spaces like private hotel rooms. But one of the things that the PD could do is help organize and advocate for that additional federal, city, state money to provide rent assistance, build supportive housing, provide mental health services, and actually get the things that we need for folks who are experiencing homelessness.
Let's tackle the hotels, because you've mentioned it now, and we've been watching video of it. The Guardian Angels, in fact, are stepping up patrols on the Upper West Side, where several hotels are being used to temporarily house the homeless, following complaints from residents in the area about open drug use, sex offenders living in that area. We've also had folks in Queens worried about former inmates at Rikers being housed in hotels, but the police there are saying, look, it's better than the alternative. They will be on the street. So what is the best and the most helpful response here? Because you're dealing with a multitude of issues.
Yeah, I think stigmatization is never helpful. And one thing I want to be really clear about is that people don't deserve to die because of their income status or criminal history or race. And we are, what we're seeing here is the city actually, providing hotel rooms to people who need it. And I want to be clear that we've been working with epidemiologists at NYU to calculate the age-adjusted mortality rate for single adults in shelters as a result of COVID. It is 80% higher than the New York City overall rate. So people are dying. It is a life and death issue. We need hotels to provide safe space for people to be able to abide by public health guidance and isolate. What we actually need is for the city to do more and provide private hotel rooms instead of double occupancy, and offer hotel rooms to every person on the streets and every person in congregate shelters right away. So that's really what we need in order to save lives here. And I'll be clear too that it's saving lives of people who are homeless, but it's also a public health issue. It's preventing the spread of the virus and providing safe spaces.
But Giselle, if you're talking about a public health issue, you're also asking for the city to open up the subways to the homeless. So isn't that creating more of a problem?
So to be clear, what we're asking for is the decriminalization of homelessness. And what we were talking about with respect to the subways is the fact that that closure of the subways was really motivated by the fact that people were seeing the poverty and homelessness throughout New York City more than they had before. And so with the subway shutdown, that problem has been dispersed, but it has not been solved. And so what we need to happen now is for investments in real, actual housing. We need that from the federal government. We need that from the state and city governments.
Got it.
And we need to move away from the model of criminalizing and moving people further into the shadows and actually providing the resources that are going to help.
It's definitely a tough issue to tackle on many fronts on it. I appreciate your time today and helping us at least try to dissect some of it. Giselle, thank you for your time and your work on this issue.
Thank you for having me.